Welcome back. I'm Dr. Farber.
I'm Dr. Shaw. So today we're going to be talking about breast augmentation. So it's one of the most popular procedures in plastic surgery, and breast augmentation basically is making breasts larger, so enhancing what you already have.
Yeah, so it can be done with two different ways, fat grafting or implants. And implants come in two different varieties, two different kinds, saline and silicone, as most of you would know. Kind of the myth is that the saline implants, they actually do have a silicone shell. So there is silicone in a saline implant. However, it's filled, instead of with silicone, it's filled with saline, which is basically salt water. Then the other implant is a silicone implant, which is a silicone shell with a silicone fill. The newest generation are nicknamed the gummy bear implants, because if you take a gummy bear candy and you cut that in half, the inside of the gummy bear doesn't leak out. So the same thing, if the newer silicone implants were to rupture for whatever reason, typically the inside doesn't leak out. It stays in place. And these are the form stable of the gummy bear implants, and these are the ones that we use most commonly.
Another procedure that is becoming more popular is fat grafting. And fat grafting is liposuction of anywhere on your body, and then we take that fat and then inject it into the breast. So it's great for people who want to avoid an implant, like a silicone or saline implant, but then they do want to have some enhancement of the breast. The limitation of fat grafting is that only a certain amount can be added to it before the fat starts having problems. So you can increase maybe about a cup size. The other limitation is that if you don't have fat on your body, we can't put it back and we don't have anything to put into the breast.
Right.
So it's a great option. And sometimes it can even be added when somebody gets a breast augmentation with an implant. We can add additional fat to the top.
So how do we put the breast implants in? So typically the incision that we make is through the inframammary fold, or IMF incision. That's under the breast. There are other approaches like around the nipple or through the armpit or even through the belly button. But studies have shown, and we find also in our experience, that the safest way and the best way to put breast implants in are through that inframammary fold incision. It allows us to control the placement of the implant the best, and it's also associated with the least amount of complications down the road, which may be capsular contracture. And that's stuff that we can talk about in another video, but this is typically the safest approach to putting in a breast implant.
Inside the breast, there's different places where the implant can sit. So it's either under the muscle or over the muscle. And the muscle that we're talking about is the pectoralis muscle. It attaches over here in the humerus, comes across over here. And for the under the muscle approach, it's released from down over here, and the implant is placed under the muscle. The other approach is going above the muscle. And the way that we do it is called a subfascial method. The typical method is a subglandular method. Subfascial, what that is that over the muscle, there's a layer called the fascia. And we like to put the implant underneath that fascia. So we lift it up off of the muscle and place it there. It has lower risk of complications with infection. It tends to be a little bit stronger, and it creates a better outcome. And it takes a little bit more time than just putting it in the subglandular plane, but I think it's worth it.
Right, yeah, I agree. Let's talk about recovery really quickly. Most patients want to know how fast can they bounce back after their breast augmentation. So typically it's pretty fast. They're not that painful. In the operating room, we will inject local anesthetic into the muscle to provide some good postoperative pain control. You'll get pain medication as well. We do want you to refrain from strenuous upper body exercise or strenuous exercise for that first 4 weeks or so, specifically upper body lifting, nothing more than 15 pounds. You'll be in a surgical bra afterwards for about a month while your incisions are healing. And then after that, if you're healing well, then you can go back to normal activity. So it's a pretty quick recovery.
Yeah. You know, one of the questions we get a lot is, do I have to change out my breast implants after 10 years? And the answer is?
The answer is, basically, if you're not having issues, we just leave them alone. In 10 years, it's different for everybody. So, you may see a patient that has problems with their breast implants after 5 years, or after 10 years, or after 20 years. So typically, if it's not causing any issues, then we just leave it alone.
Yeah, it's not a tire rotation.
That's right.
Do it only if you have a problem.
Do it if you have a problem. Yep.
Yeah.
And that's it for breast augmentations. We'll see you on the next one.